a catch up?
It was incredible. Very honored.
Oh, bless. Oh, what's going on here? No. Streaming has been initiated.
Streaming has been initiated. Let me just go to Facebook.
We've got the Edinburgh Festival on, Bob.
Say that again, Collette?
We've got the Edinburgh Festival on here. It's a worldwide festival, and Edinburgh's teeming with thousands of people, thousands.
I'm sure that's
right. We're now live on Facebook, so I hope you have a very good session, you both, and I'm sure it'll be interesting as always. And I will catch you at the end.
Okay, thank you very much. Hello, everybody. Hello. Good morning on the States. Bob, lovely to see you again. If everybody's wondering why I'm here, Robert's off doing a fundraiser doing the West Highland Way. So if he can't come in, he might come in later on, but I'm going to be here anyway. So hello, Bob, how are you?
Doing well. Thanks for having me. Are you doing well also?
Yeah, I'm doing very well. Yep, I've been up, done some exercise, been out on my bike, and yeah, semi-retirement is suiting me.
Congratulations.
Oh, yeah. Good morning, good afternoon, Robert. Robert is walking what's called the West Highland Way, which is an enormous walk on behalf of the foundation. So please go to Just Giving and support him. But I would also note here, Robert recovering from COVID, very breathless.
Yeah.
Robert?
Hi guys, I think I'm live. So
yeah, we're live.
11 miles in. I just wanted to say hi. Sorry I can't be with you today, but starting the 96-mile trek over 5 days today. So if you want to follow the progress, give us your witty comments. Anything goes.
Where
great to see you.
Robert, where can we follow it?
So I think there's actually going to be stuff on our Facebook page. It'll be on Twitter. And I'm out of breath. So I'm going to go. Bob, nice to see you.
Robert, nice to see you. Robert, look after yourself. Take care. Have you got a medic nearby in your team?
Almost.
Robert, keep in touch with me, please. Take care. Good luck. Bye. Somebody says knee deep in listen in, but we certainly are. The bins on strike. Do you know 96 miles is a heck of a trek, but you can hear he's breathless, Bob. That's the aftermath of COVID, and that's going to make life just a bit more difficult for him.
It's fantastic. He's doing that. That's incredible.
Yeah. Well, I'm very not, and I would just say to you as well, to everybody out there, thank you so much for joining us. It's lovely to see Bob. I'm a wee bit worried. I don't know who knows who doesn't. Bob, you wouldn't have known. My younger son Chris had a mammoth heart attack 3 weeks ago. So they got him in time, which was fantastic. But so I'm worrying about Robert. I've gone into mother mode. So Chris is recovering. It's going to take him some time, but lots of people, Chris, if you're in here today, are sending their love and best wishes to you, because we've all been really worried. It was great work what the medics did. Great work. Okay, Bob, PBC. Who knows anything? We know the lot. Right. You ready to go, Bob?
Ready to go. Absolutely.
Ready to go. So. As well as having PBC, I'm diagnosed with having atrial fibrillation. I started them on menopause 10 years ago. My joints, knees, and back ache constantly. I'm only 48, but I feel like 70, which is awful. I was recommended to take Easy Flex, as is known for its anti-inflammatory benefits. Do you know if this would be harmful for my liver disease and make my PBC worse? I assume that Easy Flex is something, some kind of herb or a non-medical solution or tablet or something, Bob.
What I looked up Easy Flex on the internet, and it has a number of natural ingredients that support cartilage and anti-inflammatory. Glucosamine, chondroitin, hyaluronic acid are three of the big ones. And the good news is that those don't appear to have any harmful effects on the liver. There is a couple of herbal extracts, something from boswellia and looks like curcumin, but I don't identify anything on that list that's harmful to the liver. So it's going to be really a test to see if it's working for the person and if it's going to help their symptoms or not. So no harm, may benefit. But can I make one other comment, Colleen?
Please do.
PBC is an autoimmune condition, an autoimmune disease that is associated with other autoimmune conditions where the immune system can attack other tissues, other organs, including arthritis, which is, I think, reasonably common in PBC. What's your experience, Collette, in terms of hearing about arthritis symptoms or diagnoses in your PBC patients?
We hear it quite a lot, and also sometimes you don't know where the pain is coming from, because people have Sjogren's syndrome. People with PBC have Sjogren's syndrome, dry eyes, dry mouth, but that can also affect the joints. Sometimes you don't get to the bottom of where the pain is coming from, but its treatment is important. Anti-inflammatory medication is quite difficult for people with PBC, but what I would say, and I can't comment on anything that's not prescribed and I'm not a doctor, but it is important if you do have arthritis, if you do have aches and pains and soreness, not to lie down. Movement, the muscles supporting the joints is really important, and it helps the pain. It takes a while, but it's really important to keep yourself as fit as possible, keep your muscles strong to support those achy, sore joints. But I would also say that to say that I'm 48 and feel like 70, I don't know if it's worth going back and just checking to see if there's anything else going on. Do you think so, Bob? Because, we do get other things in the PBC. We get thyroid, we get lots of different things where if anything's different or anything's drastic, I just think it's worth another consultation. Would you agree?
I completely agree with you. And people need to look to see if they have sprue, a gluten allergy. And I do a test called a C-reactive protein. It's a blood test, very simple, very inexpensive. It also scores how much general inflammation is going on. I do try to put my patients or advise them to be on an anti-inflammatory diet, which is much more of a vegetarian diet than red meat.
Interesting. Right. Okay.
What do you think about that, Collette?
I'm very interested in that because it was something last September, I remember you did a webinar for us and you mentioned about not eating meat and preferably chicken, but better without both. I thought I must come back and ask you about that, and you've just mentioned it now. So you feel that's the way forward?
I think it's very important to be on a fish Mediterranean type diet. It's good for the heart. It's good for the liver. It definitely changes the biome and the intestinal tract and the biome, the bacteria in the intestine influence general health as well as the liver.
Okay. So anybody wants to come back and ask more questions about that, watch out for Bob on these slots because it's an interesting subject. Now, I'm going to go to the next question. I'm going to put a wee bit on the end of this. I was diagnosed with PBC 3 years ago. I currently have a very swollen stomach, constantly itching and feeling sick. Food seems to stick in my throat, and I've put on quite a bit of weight. I also have chronic kidney disease, grade 3. I'm also having problems trying to contact my consultant, who I've not seen for 2 years. Is a swollen stomach normal with PBC? And what is the lifespan of this condition? Now, before we go any further, I can tell you that I have been chatting to this person, and this person sent me the photographs, and I was staggered, and this person looked heavily pregnant. So I've urged them to get hold of their consultant by email and their own general practitioner without delay. And if needs be, send them the photographs. I don't know whether it's kidney or liver, you wouldn't know from a photograph, but it was clear something was not right. So I think, I don't know if you would add anything to that, Bob.
Well, I think this is a very important, this person be seen right away. The swollen abdomen could be ascites, which is that fluid collection. And that can occur from the liver or the kidney, or they can amplify each other because they're both involved with clearing water and salts from the body. And a person with PBC, according to the guidelines, should have lab tests and be seen every 3 to 6 months. And I think that should preferably be with a consultant, unless the primary care provider is really agile in the PBC world.
Good description, actually, agile. So this person, I know this person's listening today. Please come back to me, because I do worry, and but I'd like to know how you're getting on and if we can help further. And I'd like to know that you have actually touched base with a medic. That is really important. Thanks for that, Bob. So next one, I've been described amlodipine, 5 milligram tablets for high blood pressure. Since taking it about 20 days ago, had swollen feet and ankles. I read the side effects of this medication. It states that 1 in 10 experience this. When I was diagnosed, I was told that I already had cirrhosis. I'm 83 years young and a little worried about taking this medication. But PBC for 10 years, and I'm wondering if it's safe.
Well, amlodipine in general is a very safe blood pressure medicine, antihypertensive.
Yeah.
But there is this side effect. I've seen this before. There's something shifting with water and sodium salt retention. So the provider who started the amlodipine should be talking to the patient and changing to a different antihypertensive. ACE inhibitors are often used in this high blood pressure condition. Also, they also can cause some kidney changes, some potassium changes. So close follow-up would be very, very important here. Swollen feet and swollen ankles could be a sign of just progression of the PBC we talked about before. Water retention occur on the abdomen and the ankles. So cirrhosis patient, it's important to reassess stage, a physical exam, abdominal imaging like an ultrasound would also be in order if that hasn't been done in the last 6 months.
Okay, that's actually very good advice. Because someday I'm on Mona from the States, on a plant-based diet and feel great. I do eat fish. Great. And Mona, I know you've lost stacks and stacks of weight as well. Well done. Good. Somebody's listening to you, Bob. There you go.
Thanks,
so
Mona.
this person is 83-year-old person who so please go back and chat to your doctor. I think that's important. So next question was, I was diagnosed with PBC in 2020, having had fatigue for 3 years. And this has gradually worsened. I have a feeling of being weighed down all over. I find even the simplest task of making coffee, I require a nap, but never feel refreshed. I have chronic constipation, which is controlled with laxatives. Food gets stuck in my esophagus. I have a cold, numb sensation and severe restless leg syndrome. My GP wants to investigate autotonic, I think I said that correctly, dysfunction. Now, the question is, can you please advise me how to manage the symptoms? I'll let you go first, and I'll say something.
Well, there's a lot of questions here, of course, and we'd like to both highlight that PBC is this condition that affects every part of the body, including how the brain works and your feeling of energy or lack of energy. We don't understand the mechanism or how that occurs exactly, but we think it's related to this inflammatory state. And it's really important to be on this anti-inflammatory diet we described earlier. Coffee is good as long as you drink that in the morning and it doesn't disrupt your sleep at night. Coffee is anti-inflammatory. It helps protect the liver. It has an anti-cancer effect. So coffee is good, up to 3 servings a day in the morning. The constipation, I don't think that's directly related to the PBC condition, but the food sticking in the esophagus, I think is related to what you mentioned before, Collette, the Sjogren's syndrome, the dry eyes, dry mouth, decreased saliva. So that can be treated symptomatically with different types of some hard candies that don't have sugar, but can stimulate saliva production. And just always drink lots of water when you're eating food. Chew your food really well so you don't get an impaction or a blockage in the swallowing tube in the esophagus. Finally, the cold, numb sensation. We see a lot of patients with liver disease feel cold. They have somewhat of a decrease in body temperature. Don't understand that completely, but just wear, warm clothing, protect your blood vessels, your circulation. Restless leg has been seen with many different conditions. There's a number of medicines that are even FDA or regulatory approved for restless leg. And that's something the GP or neurologist could help with, as well as this autonomic dysfunction. Autonomic means what we use to control our blood pressure, our sweating, our heart rate. The autonomic nervous system controls a lot of daily functions. We don't have to think about them, sort of computer programming. And that autonomic dysfunction should be tested. A good way to look at that also is to measure the blood pressure and heart rate laying down. Have the person stand up. A minute later, recheck the blood pressure, recheck the heart rate. And if the blood pressure drops and the heart rate doesn't go up, then there is a big problem. If the blood pressure drops on standing, that also is an indication that the blood pressure system to hold the tone in the blood vessels, especially in the legs, is weakening. And that could also be treated with different medicines. So there's a lot going on with this person. It sounds like the GP is smart and on top of things. And we have to approach these individually and then as a group.
Yeah, I would add to this. So with the autonomic dysfunction, Professor David Jones in Newcastle in England is working on this in his fatigue clinic. So I don't know where you are geographically, but anywhere in England and Wales and the UK, you can be referred to his clinic. And he is actively looking into this, what we see from time to time. I would also say to you, the coffee, I get that 100%, absolutely. And I don't think it matters if it's caffeine or not, Bob, does it?
There is a controversy about that, Collette. Some of the studies have said you need to have natural coffee with caffeine to have this effect on the liver health. And some other studies said you don't. So I think there's a little confusion about it.
Right, okay. Maybe half and half then.
Too much caffeine, though, is bad for sleep. It can worsen restless leg syndrome. Tremor and other things.
Yeah. The other thing I would say that I'm going to say, and it's something really shocking to this person, that what helps fatigue is movement. Movement we treat as medicine. The less you do, the less you're able. And every single person, whatever illness condition you have, is encouraged these days to move, whether you have fibromyalgia, whether you have cancer, PBC, and you can buy into more energy. And I swear to you, this is the truth. In the early days when I was diagnosed, we were told to rest in the afternoon. The more I rested, the less I was able to do. And now I can cycle, I can do all sorts of things, and I built up to that. But you do buy into more energy, and you never run out. You never run out of energy. But I'm not surprised that a rest doesn't make you feel any better. Why would it? So it's not as if you're sleep deprived. Your body is weighed down. It's heavy. I know exactly what you're saying. I keep my hair long because it's easier, and because lifting over a hair dryer causes me issues, which I would have to do if I had very short hair. So think about small walks 2-3 times a day, just doing a bit more, and come back to me. Let me know how you're getting on. But I buddy up with somebody. I buddy up with lots of PBC people. They phone me, tell me what they want to do, what they are doing, what they're not doing, and we have a running commentary, and we speak to each other quite a lot. We buddy up on the telephone, And also we have a pen pal system in the foundation. So use that opportunity. We've got lots of people around, people in the States and Canada and all around the world. Buddy up with somebody and set some goals for yourself. Small ones, just a wee bit at a time,
Nice. I agree.
Yeah. So we go on. I'm a 50-year-old female, about 20 pounds overweight. I drank alcohol moderately, about 7 to 10 drinks a week. The doctor always says this wasn't a cause of PBC, which is not. I take no medication except vitamins and seldom take a Tylenol pain relief. I don't know that. My liver enzymes and platelets began being elevated in the year 2000. The elevation was slight. Then alkaline phosphatase, AST, and ALT all became higher than normal. I went through a series of scans, no symptoms. I also went through scans in 2013 as well, nothing was found. I've recently started experiencing pain and stiffness in my joints, especially my hands in the morning, and just had a liver biopsy. Is it common to have something as serious as PBC without symptoms for years?
I think the answer is easily yes. You can have PBC asymptomatic for decades even. I usually use the rule that 60% of PBC patients have a lot of symptoms or a set of symptoms that are consistent, but up to 40% have mild or minimal symptoms. This joint pain or stiffness that's ongoing could be a sign that the PBC is starting to evolve. As we mentioned earlier, anybody with the diagnosis of PBC should be monitored for thyroid, arthritis, basically all the different parts of the body, the organs, the tissues. And it's going to be very important, of course, to see what the liver biopsy shows in terms of staging, inflammation, and if there's anything else going on. Being 20 pounds overweight, moderate alcohol intake, fatty liver could easily be part of this. I'd like to know the lipid profile, the glucose, to make a full assessment.
Yeah, I think that's very fair. There's something else I just want to go back to, just in relation to people who are very tired and very fatigued, and people, the lady previously who takes laxatives. I mean, this is a pint. I don't know what measurements people use around the world, but this is a pint. And I maybe have 8 or 10 of those in a 16, 17-hour period. You know, we become dehydrated. I think people with PBC, Bob, you maybe think about this. I think we need a bit more fluid than normal, because I've been, you know, somewhere driving in the car 3 hours. I'm so fatigued, and then a couple of pints of water. I'm like a flower that opens up that's needing watered. So I think the bowels, laxatives, up your water, and fatigue as well, up your water, and take a wee note and see if it makes a difference. I'm a big fan. How lucky are we that, I don't know what I'm sure it's different parts of America. How lucky are we can go into our kitchen and turn on the tap and have fresh water, drinking water. How lucky are we? Take advantage. I think that's medicine as well, obviously.
Totally agree with those comments, Collette. That's great.
So last year I suffered a bad case of glandular fever. Oh, it's awful. After having a yellow tinge to my skin, I went to a private liver specialist who found I have AMA and M2 antibodies, 1/40. I'm 20, I'm pregnant, so they're monitoring my liver. Can you explain what this result means, please? I don't know if you've got enough information there, Bob, would you say?
I don't know what glandular fever is, what country or what part of the world.
So glandular fever, they've got another name for it. Epstein-Barr syndrome.
Say that again. What syndrome?
Epstein-Barr.
Oh, Epstein-Barr. Oh, okay. Yeah, that's obviously a virus that causes mononucleosis. Sounds like glandular fever. Yeah. This can inflame the lymph nodes throughout the body, cause a rash, fever, fatigue. People can sometimes be down and out for 4 to 6 weeks with that. But that's very unlikely to be connected to the positive anti-mitochondrial antibody. I think that is a separate process. Although autoimmune diseases like PBC have a genetic predisposition and then some type of trigger. So theoretically, the glandular fever could have triggered or brought out this PBC in some patients. What do you think? Is that something that you might see a connection?
Yeah, perhaps. And do they not say that Epstein-Barr symptoms can come back again, you know, later on? You know, that you're having these kinds of things. I don't know. I don't know a huge amount about it, but they're certainly similar symptoms, aren't they?
Yes, and yeah, there could be some overlap there. But the AMA and the whole issue about checking the alkaline phosphatase, and as you know, I really like the GGT. I want to know about that and understand the patient's pregnant, and of course, monitoring liver enzymes and separately monitoring liver function. I'm glad everybody here doctors using this new correct terminology. The 1 to 40 is a significant type, right? But that 1 to 40 just basically means further workups needed, not necessarily a biopsy, but staging disease with even something like fibroscan or elastography would be important. So full workups in order. That's the summary for you, and then wishes with your pregnancy.
Yeah, and all the best, absolutely. But normally, what I hear for a diagnosis of PBC is, as you say, the antimitochondrial antibody, but they haven't mentioned anything about the alkaline phosphatase here, the ALP. So it belongs to this question. Do ask about your ALP, alkaline phosphatase. Big words doctors use, don't they? Okay, I have Raynaud's, Hashimoto's, PBC, and now Levedo reticularis, which showed up on top of my feet and is now going up my leg. I think it's sort of thread vein type things. I find this quite distressing. Have you heard of this condition, and is there any information you can give me? Now, I know this lady's in Manhattan, so she'll speak your lingo.
Oh, I see. So livedo reticularis is a relatively common skin condition that's basically a color change in the skin surface. And a lot of little tiny blood vessels often show up. You can get a purplish or reddish color. So in many conditions or many situations, it doesn't mean anything. It just is a cosmetic change. But if this is bothering the person from a pain perspective or some other symptom like itching, that's going to require a further workup and talking to a dermatologist. Whenever I hear skin condition and somebody with PBC, I'm always going back to this question about celiac sprue. There's some definitely skin changes that can happen in people who are gluten sensitive. So definitely a gluten assessment would be recommended here as well.
Okay. I know she's been very wise. Somebody, Julie, has just said glandular fever, colloquially known as the kissing disease. That's right. My mum told me that, due to young people getting it in high social settings. Kissing disease. There we go, Bob.
We use similar terms in the US.
Yeah, I won't ask. Okay. So I was diagnosed with PBC last year. I'm on URSO. I am an URSO responder, but we're on the low side of hemoglobin around 115, and more recently my red count levels have dipped to 106. I have fibroids, but no real symptoms relating to that other than bloating and weight gain. No other obvious signs of a bleed, but it's causing low iron stores. My symptoms are primarily fatigue and some itch, which may be related to PBC or anemia. Can anemia be linked to PBC and possibly malabsorption? In brackets, my GP is not sure, and I cannot take iron as it upsets my tummy. She's got IBS. It must be said I'm overweight and just cannot shift it.
So whenever we talk about PBC, we're always looking at the red cell count, hemoglobin, hematocrit. And as soon as we hear the word anemia, it comes back to the workup for celiac disease, because it often presents with iron deficiency anemia. It is a malabsorption condition because of changes in the lining of the intestine. So absolutely celiac sprue. If you're 45 years of age or older than 45, colonoscopy is going to be very important. And then potentially a workup for Helicobacter ulcer disease of the stomach is going to be important as well. So iron supplements, there's probably 15 or 20 different types of iron, including liquid iron, different iron salts. I can always find one that the patient can tolerate, that can take. It's the iron tablets that are really pretty nasty, iron sulfate. So there's different iron preparations, and you can explore those over the counter or prescription to find one that doesn't bother the irritable bowel syndrome. And one final comment, Collette, is this overlap between PBC and fatty liver, which many people are now.
Yeah, it's more common.
And we really think that people with PBC shouldn't be drinking alcohol, because alcohol can amplify liver disease, and also need to bring their weight down to a healthy body mass index. And everybody can lose weight. It requires a change in vision, imagery, motivation, calorie restriction, more exercise, and manipulating how people eat food to keep that hunger drive down. That's what drives people to eat. Of course, they're hungry and they want to eat. It's, it makes you feel better. But there's some really good, and on my website, there's a really wonderful 100% perfect weight loss program that if you follow it, it always works. So just go to robertgish.com and download the weight loss roadmap.
That is fantastic. I'm just taking a note of that, Bob, and we'll make sure we get those details out. So 14, 28, 20, 42. So I've lost about 48 pounds in weight. I gained extra weight because of steroids that I was put on for a few months. And I have lost that amount of weight. And I did it by literally counting calories. I don't know what Bob's website says. I'm going to look. And exercise. Exercise is the key. And you don't have to go to a gym. You don't have to do weights. If you tend to beans, if you use your muscles, you're going to burn up more. You're walking, count steps on your phone, tuck it in your waistband, or get a Fitbit. Measure and set yourself small goals, and be pleased with yourself that you're doing it. Congratulate yourself. You can change how you think and feel. I'm very, very old, and I did. I never thought I could. And it's really nice buying smaller clothes and get rid of larger ones. But yeah, it helps the joints. It helps your breathing. It just helps. It just all round fantastic stuff, isn't it, Bob? So, right, I've had PBC for a year. I'm now very confused. I've been told I've probably got Hashimoto's too. It's not uncommon. And looking for a diet that is best for Hashimoto's, information tells me it should be grain-free and take probiotics. As I am not a meat eater, I eat lentils and oatmeal every day. Fantastic. Cross-checking with PBC information, it tells me not to take probiotics for liver disease, so I'm confused how to best help myself. The diet that is best for one seems to be the worst diet for the other. I would welcome any advice. Oats, if you're eating porridge oats, they also bring down your cholesterol. Porridge oats are fab, however you take them, raw or cooked. So Bob, probiotics.
I'm going to go to the word inconsistencies for a moment and really describe that we are all individuals. We're all different. So I'm not going to say this is necessarily an inconsistency. It just means an individual's diet needs to be customized for them. So that's the first situation. And there's these different types of food elimination diets where you can figure out what might be causing either intestinal symptoms or something systemic. Hashimoto's is another one of these autoimmune conditions that attacks the thyroid gland. And this anti-inflammatory diet, which this person appears to be on, is good. The whole issue about grain, which is really talking about wheat, because oat is a grain. Oats are, of course, gluten-free and are quite safe from that sprue perspective. And that, again, is customized to the individual. And there are people who are gluten intolerant, even though they don't have sprue. Yeah. So it's really a diet log, a food elimination diet that's going to really help intestinal symptoms and inflammatory symptoms. So that's part 1 and 2. Part 3 is the probiotic question. The only probiotic that I tell patients not to take is one that has some type of yeast or fungus or something in it. Yeah. The antibiotic-based probiotics in general are quite safe, unless somebody's in liver failure in the hospital, then of course they shouldn't be taking them. But anything that says not to take probiotics with liver disease is a very broad statement and I think incorrect. And I use probiotics in all of my fatty liver patients, actually. And also PSC, I think, is very much as a biome disease, and probiotics are useful. We need trials in PBC about what probiotic to use, how to use them. We need more research, more information.
Yeah, perfect. But it's lovely that they're taking the time to look at what they eat and to look up information about probiotics or live or whatever. It's good if you're looking at what you eat and how you eat it. It's great. I've been taking Urso for nearly 2 years. I'm a responder with now a normal ALT and ALP. Great. Prior to PBC diagnosis in 2020, I'd been treated for 6 years with azathioprine for AIH. I gather this switch can happen. I'm wondering why, given now normal ALP, I am so fatigued, have poor sleep, occasional itch. By lunchtime, I'm energy-less, even if I've slept well. I was advised to take OCA nearly 2 years ago. I'm quite nervous about taking it, as it's quite a new drug, and I did not know the effects taking it long term. I was advised it would probably only be needed for 12 to 24 months. I have now been advised to take it longer term, but still have no idea of long-term effects. Can you give me information on long-term effects of taking OCA? Now, I'm a bit concerned about this, Bob, because this person says that all of a sudden they seem to be fatigued, poor sleep, and occasional itch. So something to me seems like it's changed. By lunchtime, I'm energy-less, even if I've slept well. Now, if they have normal ALT and ALP, but more symptoms are being developed, I'm unsure where the OCA comes in as well. Can you help with that?
I completely agree with you, Collette. And what we're emphasizing here is how useful the alkaline phosphatase is. And of course, I follow GGT in all my patients. But the alkaline phos is under 115. That patient's prognosis is excellent. Yes, the patient can progress with the normal alkaline phosphatase, but that's quite rare. So I don't see a role for OCA from a liver enzyme perspective. I, of course, would like to know the bilirubin total, bilirubin direct. This person's correct. You can switch from AIH to PBC. And in fact, I use Urso to treat autoimmune hepatitis. I have a number of patients who don't need azathioprine on Urso. And it controls their AIH as well as, maybe an overlap syndrome. The ALT, ALP are not very well linked to fatigue or sleep or itch. And you definitely need every year a fibroscan to look and see if the disease is progressing or regressing, and treat the itching, the sleep, the fatigue separately. And there's medicines like modafinil, SSRIs are good for itch and give patients energy often. And back to the obeticholic acid question, I don't see a role for obeticholic acid unless they have clearly progressive liver disease on Urso by imaging or biopsy or what we call NITs, non-invasive tests. And the final comment is we have now nearly 7 years of data on obeticholic acid. The 5-year data from the POISE, P-O-I-S-E study has been out. It appears to be very safe. We have lots of new medicines, new information. This is not a new drug. This medication has been under research for 15 years for different conditions in thousands and thousands of patients. If people are given OCA and it's working, people are on it indefinitely because this is a chronic disease. And I don't stop OCA if it's working, because if it's working, that means you continue it. So a lot of comments, a lot of questions. Collette, what do you think?
Yeah, I would actually like this person to maybe phone in and speak to me and we can have a chat based on what you just said. But we're obviously from the same, we're singing from the same tune here. Very interested that you give PBC and you give Urso to AIH. I'm going to run that past the docs here and see if they're doing the same. Yeah, I think this is a bit of an odd story here. So I would urge this person if they want to speak or ask more questions. Certainly, please do that. And if it's not today, we can get them answered another time. But yeah, let's try and clear up the mystery. So next one is I'm under 75 years old and up to date with my vaccinations. I received notification for spring booster in May, but was on holiday. I booked another date my return, but contracted COVID. After 28 days, as advised, I went for the booster. I was told I no longer fitted the criteria, but to book for a winter booster. Apparently, the new Moderna vaccine covers the old Omicron, the BA.1/2 variant, but it's not specifically targeting the latest BA.5 variant. Would my own immune system now be protecting for me? And is there any advice you can give to those of us with PBC with regards to boosters? Well, I know that in the UK, the booster's not, it's coming out in a couple of months for this age group, in the autumn time. I'm not sure about the variants, but do we not have some kind of immunity for 6 months after we have COVID?
Absolutely, yes. It lasts for more than 6 months, but of course, the blood levels of antibodies and maybe what are called T cells starts to decline. I always tell people to wait at least 3 months after an infection to get their booster. And in 3 months, we are going to have these new vaccine derivatives. I personally have taken 3 Moderna and 1 Pfizer. And every few months, I actually check my titers for antibodies to spike and to nucleocapsid. And I've got titers that are up in the 10,000 range, which I think is protective, although there's controversy of whether those antibody levels really protect people.
Yeah.
I'm 3 years into this pandemic and I have not had the infection yet. So I'm a strong believer in vaccines, boosting, and safety. Of course, I wear a mask in high-risk situations. I wash my hands every day, get lots of sleep. Sleep is critical. So I think they're doing the right thing. Wait for the new booster variant to come out. And we think that vaccines are very safe in autoimmune conditions, but there have been very rare. This, again, I don't want to overemphasize this. There have been reports where vaccines stimulate an autoimmune condition. And that's what we talked about at the beginning. PBC is genetically programmed or predisposed, and then a trigger can come in at age 20, 30, 40, 50, 60, 70, and bring out the disease clinically so we can see it.
Yeah. Okay. Right. We've got stacks of questions coming in now. Bob, so I'm going to hammer through them if we can. Diagnosed PBC 2009, have difficulty swallowing, which was considered to be lack of saliva from secondary Sjogren's, which, we've discussed. Not prescribed anything, just told to live with it. It's now been discovered to have an esophageal web. I read that they can sometimes be due to autoimmune issues. Therefore, my question is, can either PBC or Sjogren's cause an esophageal web? I've never heard of that before, Bob.
I don't know about a direct connection, but a web is a piece of scar tissue in the esophagus, and it can be clipped, removed through an endoscope or opened up through an endoscope. But when I hear of esophageal problems, I think about autoimmune diseases. I want to make sure the patient doesn't have pernicious anemia, which can be a vitamin B12 deficiency. It's also autoimmune. So I would say, get a workup for pernicious anemia, treat the Sjogren's, as we mentioned before, keep the saliva flowing, lots of liquids, brush your teeth. Really good mouth and dental and oral care is important in everybody, but autoimmune diseases especially.
I can also add to that, for those of you who do have a dry mouth, please do not use chemically based mouthwashes. They have an adverse effect. They ruin the taste of food and they stain your teeth, but they make your mouth drier. So if you needed something to really clean, you mean salt water, rinsing it out. You can use sugar-free gum, but do not use chemically based mouthwashes, please. Dentists, hammer me on this one. This next one, I'm not sure we can answer. A question about herbal supplement. A friend had a stroke and she used something called lion's mane, recommended to help her with post-stroke fatigue. My fatigue is a different source, but it's lion's mane, something safe and potentially beneficial for me to take. If this is herbal medicine, which hasn't been tested, I'm not sure that we can actually comment, Bob, can we?
We know very little about herbal remedies in treating autoimmune conditions. And the fact that it's unknown, I would be very cautious and not stir the pot because herbs can be contaminated. You don't know what's in it. Just many questions. I don't think herbs should be used to treat PBC.
Yeah. Okay, thank you. You mentioned in the past the importance of ultrasounds and get a measurement of the spleen. Is this something you practice with your patients, even if the fibrosis is mild and PBC stage 2? I have an appointment with my hepatologist tomorrow, and he says only if he's looking for cancer.
So every time an abdominal ultrasound is performed for a patient with a liver condition, the radiologist, the technician, should measure the spleen size and the portal vein diameter, because that tells us the level of portal hypertension, how high the pressure is in the liver spleen system. People with PBC, once they have fibrosis level 3, which is bridging fibrosis, not cirrhosis, can develop varices. They develop varices, these veins in the esophagus, much earlier than other patients, say, with alcohol-related liver disease or fatty liver. So I really think this measurement is simple. It's free. It takes a few seconds, and it adds to the clinician and the patient's knowledge of staging.
Great. The next, this is more common. I'm quite active, but I have setbacks proportionate to the extent to which I have done things. If I do overdo things, help. Pace yourself. But if you know of any woman who knows how to pace herself, come and tell me how to do it.
Smart.
Work out yourself. Take notes. What you're doing, how you do it, how long it takes you, and maybe what you've had to eat around your exercise as well, because that can sometimes have an impact. So a bit more information would be helpful here, I think, but keep up the movement. Keep it up. Well done. So hang on. I've got it right. Did you just say that PBC can regress as well as progress? Somebody's asking. Did you say that?
So it's a great question. And I believe, yes, it can regress on treatment. I've seen regression on URSO. I've seen regression on URSO plus OCA. It's relatively rare to regress in 1 or 2 years, but at 3 to 5 years, I've seen some reversal. But also at the same time, we're telling people not to drink. That helps reverse liver disease, I believe. Lose weight, treat fatty liver. That can also reverse liver disease because these have amplifying effects on each other. So I'm quite optimistic. There is some very subtle data with OCA in some patients who've had biopsies or have had FibroScans that they've seen some patients who reverse. So I'm an optimist and I think it's possible.
Yeah, I mean, we mustn't underestimate fatty liver and fatty liver disease. Because with PBC, as you well know, Bob, you can have both. And you know, I noticed particularly in Scotland, it seems to be okay to be overweight. It seems to be very acceptable. But when you hear of children needing liver transplant because of fatty liver, I think there's a serious problem out there. So I know we deal with PBC, but we can't ignore this issue because people with PBC do have fatty liver. I've spoken with people, and we have to take this quite seriously. And we have to, as well as do the things, the PBC, medication, and all the rest of it, we have to look at our lifestyles. We absolutely have to, because this will just make our whole scenario worse and potentially shorten lives, really, doesn't it?
I mean, I talk to my patients who have obesity issues, especially because I'm seeing them with fatty liver. And I ask them a relatively simple question. How long do you want to live and what quality of life do you want to have? Our bodies are programmed to live at least 100 years. You know, you've heard of people living to 110 or 120 who take care of them. And these people are thin. They may, of course, not have liver disease, drink modestly. They're on a Mediterranean diet. They don't smoke cigarettes or simple things. But being overweight, obese, and having fatty liver shortens a person's life and increases the risk, not just for liver disease, but for many types of cancer, heart disease, and kidney disease. So being overweight is not healthy. Being obese is not healthy. And I know there are things in the newspaper saying, oh, don't worry about your weight or don't worry about your BMI. I don't know what planet they're on, but they're not on planet Earth.
Yeah. And you know as well, Bob, we have a responsibility to ourselves, but who wants to look at their mum becoming more and more unwell when she might be able to do something to help herself, or your granny or your brother or whatever? You know, we've got a responsibility to people around us to keep ourselves as well as possible. I feel that way. Maybe I'm wrong, but I feel that way. I'm right. My GGT is 472, ALP 284. I have the ANA antibody, but not AMC. I don't know what AMC is. I don't know. AMC? Do you know, Bob?
I think it's just another one of the antibodies that you can get in an autoimmune panel. There's about 7 or 8 different ones that are often assessed.
Okay. GP has just referred for ultrasound. My liver enzymes have been elevated for nearly 3 years. They say I have to have AMC antibodies. Is this correct? I think you might be, what we'd be looking for with PBC is the AMA, anti-mitochondrial antibody. That's what they'd be looking for. So maybe this person would like to come back to us, because if you do have the AMA antibody, you have an elevated ALP, that is really indicative of PBC, isn't it, Bob?
And you have high ALT and positive anti-nuclear antibody, they could have an overlap syndrome.
Yeah.
And this is a reason to consider a liver biopsy. Many patients with PBC don't need a liver biopsy, but this is a setting a liver biopsy could be discussed.
Mm-hmm. Mm-hmm. Okay. I have been diagnosed PBC in December 2021, so it's quite recent. Had the liver MRI, didn't show any changes. Happy, but wonder if I really have PBC. Oh, well. If you've been diagnosed, you don't say in your question, whoever sent this question, you don't say if it's been a normal procedure, i.e. The AMA antibody and increased ALP. You don't say the circumstances of your diagnosis. So it's a very different comment, but you've had an MRI and it shows no changes. I'd be very happy with that.
I think you're describing the workup correctly, Collette, and I'm really glad that people are using liver enzymes and not describing liver function.
Yeah.
When people send in their information, we really want to know the total bilirubin, and if the total bilirubin is greater than 0.6, we want to know the direct bilirubin. So I think you've really outlined what type of workup people should have today, and we really expanded what information we need when people are asking questions.
I got a great question here, Bob. How could I get fatty liver in a 6-month span? I'm not overweight. I don't smoke or drink. Started when PBC was diagnosed. All scans before that for 6 years were clear. So.
Great question.
Yeah.
And it's funny that you mentioned this, because the AGA, American Gastroenterology Association, came out this morning with a new workup for people with what's called lean NASH. So people who aren't overweight can get fatty liver.
Wow.
And they may have an early form of diabetes. So we often get insulin levels to evaluate them. We check lipid, cholesterol, triglycerides, what the cholesterol subsets are also. And that's really important. And also alcohol, even low levels of alcohol in susceptible people can have that. Now, appearance over 6 months, something may have changed. One thing I tell people to do is not drink out of plastic water bottles. They should drink only filtered water. In plastic, we have bisphenols, these are metabolic disruptors. France and Canada are ahead of everybody else by outlawing these in a variety of different food containers.
Wow.
We really outlaw them everywhere in the world. So bisphenol effect is a potential another influence on this. So change, new fatty liver, something is different. Talk to your provider, go into some historical detail.
Great. I've got the next question. I've been diagnosed with PBC and have AH and PA. Is there any diet that would help or food to avoid? Now, we've covered a lot about diet today, so I hope whoever asked these questions feel quite well furnished with information. To avoid, for me, I don't know what you think, Bob, you've heard me say this, one of the worst substances to ingest or to eat or to drink is sugar. I think sugar is just a horrible thing for humans to take, and it's addictive. It's hidden in foods and processed foods, and I know lots of people come off sugar and how well they feel. So, what would you comment on that, Bob, please?
Yes, it's very clear that high levels of fructose intake actually go into different cells in the body, and they poison something called mitochondria. These are the little energy factories in every cell. And this sugar excess acts as a poison to the body's metabolism. So we've talked about a lot of things today. We didn't talk about simple sugars like fructose, these different syrups and added from corn syrup. Yeah. And it's best to be on a low sugar diet, and only in the form of complex sugars, fruit, at moderate intakes, but don't use table sugar. Just don't add sugar to anything unless you're having your once a month pastry, you know?
Yeah, I'm not that keen on saccharins and artificial sweeteners either, to be honest, Bob. I don't know much about them, but a chemist friend of mine said to me they're not good for you. They're not good.
Everybody likes things natural, and those artificial sweeteners are the opposite direction of natural. They have been synthesized by the chemists to make our brains happy. I don't think that's good.
I was never given sweet things as a child, and I have no cravings for them, none whatsoever. I'm very lucky. Right, we're coming to the end now. I've had PBC for 17 years and had my ALP taken. It was 143 according to the lab. Here it goes up to 154. When I go back to Boston, the lab cutoff is smaller. So then, am I considered high? What would be considered? So what would be considered high? What is the average? Our labs different, and it seemed to be the States. What is the cutoff in the States? Now you mentioned it earlier. What, anything over 123? Did you say?
Well, some labs it's 123, some labs it's 115, but
Right.
anything over that lab upper limits of normal is a major warning sign about risk of progression. We published a paper 3 years ago with some colleagues from Detroit at Henry Ford, and we said we think the new normal for ALK phos should be around 85. So I look at 115 as really a hard cut point. Above that, I'm putting people on treatment, URSO, and then OCA, and I want the ALK phos less than 115. I'm not going to compromise at 122 or 135. You really should be in that under 115 range. So that's the normal. Healthiest probably down in the 80s. I mean, my alkaline phosphatase runs between 76 and 82. So in a healthy population, I don't have fatty liver. I've had lots of fibroscans. And that's what I think. But let's use 115 as that really solid number.
Okay. Very, very quickly now. I've just got a couple left. Diagnosed PBC, 11 years. Overlap syndrome in February this year. Put on prednisolone, which you know is a steroid. I didn't know you could have more than one non-alcoholic liver disease. Any advice? This is quite a sizable question. Yes, you can have 2 liver diseases, not related to alcohol. Any advice? Well, I don't know what kind of advice this person really is asking for, but I think given that your case is slightly more complex than just somebody with PBC, then you have to keep asking your medical person questions as they come along, and particularly with the prednisolone, find out how long this is going on for. Bob, would you say?
In my patients with autoimmune hepatitis or overlap where I use a steroid, a prednisone-like drug, I have everybody off the prednisone or budesonide, which I use much more often, in 3 months, because I'm using either azathioprine or mycophenolate, and I'm checking blood levels, and I'm bringing up the blood levels into the therapeutic range, because I think everybody can get off prednisone within 3 months. And just other providers use prednisone definitely. I don't understand why they do that. But the data would back up what I'm suggesting.
Yeah. Yeah. Do ask. In the UK, a lot of people are on azathioprine. I do hear this. So do go back and ask. 2 questions. Sjogren's and PBC, is this common? Reasonably so. It's one. A lot of people with PBC. I mean, I know my Sjogren's was diagnosed with my PBC. And of course, only nice people get PBC. You did know this, Bob, didn't you? But yes, it is quite common. Do you want to add to that, Bob?
I add the word yes.
Okay. Last question. And I can't find it. Here we are. Is yes or no? Is metformin safe for the liver?
Metformin is an anti-diabetic drug that has some very interesting properties to potentially fight cancer, specifically cancer of the liver. And also it's being used in a number of studies to increase longevity, increasing total body health. I'm just saying that's a research question right now, but there are suggestions. the bottom line is not only safe, but probably liver protective. It's the foundation of treating diabetes today.
That's it. And I know a few people. Bob, fantastic. You've answered loads of questions and we've none left. Great. I'm going to see to my physiotherapist, my dog. Thank you, Bob. It was lovely to see you again. I didn't think I'd see you so soon. Alan, Linda, everybody in the background. Also, while we've been here, we've been getting lovely messages. Chris, we all wish you well and a speedy recovery and no more stress. Chris, look after yourself, okay?
Have a good rest of your summer. Thank you. We'll see you in the fall.
Okay.
Thanks very much, folks.
Bye.
Bye just now.